You're looking at the blackest state in the nation. You're looking at a place where the government passed a strict early abortion ban in 2019. You are looking at a place with 48,441 square miles and only one abortion care provider, which doesn't even have a full-time doctor on staff. Welcome to Mississippi.
A lot of the anti-abortion movement has been essentially trying to limit or completely erase abortion access as we know it without overturning Roe versus Wade.
This Gulf Coast state has high rates of poverty, unintended pregnancies, and one of the highest rates of uninsured residents in the United States. That's why I've decided to travel here and figure out what the Magnolia State can tell us about abortion care around the nation.
You are propagating the murder of children, and you will be held accountable. Do not be deceived.
I took birth control, used protection. Anytime we had unprotected sex, I actually took 2 Plan Bs instead of 1.
And then you're still
pregnant.
Hey fam, I'm Imayan, and I need you to hit that subscribe button right now because we are going on the road to uncover what happens when you restrict abortion access, who is most affected, and why.
Make you fishers of men. Go ye into the world and preach the gospel to every creature.
I'm in the home of the birthplace of the blues. More than a century after the genre was created, Mississippi has evolved.
Local boy makes good.
But the grounds that were so fertile for planting new music haven't been as fruitful for growing prosperity. Mississippi is one of the poorest states in the U.S., and it has an infant mortality rate 48% higher than the national average. And perhaps that's what makes the country's 20th state a uniquely perfect battleground to explore the nation's long-running debate about abortion accessibility.
Sowing to the flesh by trying to propagate abortion.
Here, that debate is juxtaposed against overt religious themes because at a time when the United States is becoming less religious overall, Mississippi is tied with Alabama as the most religious state in the nation. Nearly half of the residents attend church service weekly, and 74% of adults say religion is very important. So when opponents of abortion care use religiously themed rhetoric to argue against access,
There's a day of reckoning before a holy God, and you will be found guilty in his presence for pushing murder.
it's language that can resonate here in the buckle of the Bible Belt.
One of the first things I noticed when I arrived at the Jackson Women's Health Organization was this loud, blaring music that they're trying to use to drown out counter-protesters on the other side of this wall. Let's go in.
The noise is one of many challenges Dr. Sanithia Williams faces.
I think as someone who does abortion care, it would be naive of me not to think about safety. But that being said, I think as a Black woman, I really probably think about safety in a different way than some of my other colleagues.
Williams is one of the people on the front lines of trying to secure abortion access. For her, this is a fight for civil rights in a place that's been the scene of so many civil rights battles. I met Williams on a humid midsummer's day in a Mississippi parking lot to ensure her safety. She's an OBGYN who has worked as an abortion provider for the last 7 years in various states. She's been traveling to Mississippi for a year from her out-of-state home to offer care. She's one of a group of doctors who rotate schedules at the state's only abortion care provider.
All of our clinicians or physicians actually who come in to provide abortion care actually are from out of state, and part of that has to do with the extreme stigma and the potential for harassment that they would face if we had a local physician who is actually providing the care here.
Williams is headed to this pastel pink building, which houses Jackson's Women's Health Organization in the eponymous capital city. It offers abortion care only 2 to 3 days a week because it has no local physicians.
How did you get into abortion care? What drew you to it?
One of the things that really stuck with me was how homogenous the doctors were. All of the doctors were older white men, and they were doing excellent care. But as a Black woman, I was seeing who the patients were that were coming through. And I was really struck by, the fact that there were a lot of Black women, a lot of women of color who were coming through.
The disparity resonated with her so much that she decided to become a practitioner.
There really was not a lot of separation between many of my patients and myself. When you think about who the people are who are having abortions in this country, they are more likely to be poor, they're more likely to be people of color, and that was very reflective of my experience growing up.
If the Supreme Court ever overturns Roe v. Wade, abortion in Mississippi would be banned immediately. Mississippi is one of 9 states that passed a strict early abortion ban in 2019.
We think that this is showing the profound respect and desire of Mississippians to protect the sanctity of that very unborn life whenever possible.
The restrictions, which Governor Phil Bryant signed into law in March, would prohibit the procedure after about 6 weeks of pregnancy.
That limitation on abortion has a cutoff before you likely realize you were pregnant. A federal judge has blocked the law from taking effect while it's being challenged in the courts.
That abbreviated timeline would have a direct effect on people like Velva Johnson. The 26-year-old is 9 weeks and 3 days pregnant.
That would have put you in a very
Right.
position.
Yes.
It means that you couldn't receive the care that you're getting.
Legally, no.
What would you have done?
I honestly would have used a third party and obtained abortion pills to go through with the procedure. So even though I couldn't have legally came to a clinic, I honestly would have looked for outside sources.
People of color make up the majority of abortion patients nationally. Black patients account for 28% of abortions, Hispanic patients 25%, and 39% of people receiving abortion care are white. In Mississippi, the state with the largest percentage of Black people in the country, the statistics look drastically different. 78% of abortion patients in the state are Black and 20% are white. Those numbers are especially telling when you realize the state's residents are overwhelmingly white.
A lot of people wouldn't have felt comfortable showing their face and using their name. Why are you?
I'm comfortable because I feel like representation matters. I worked in the corporate world where I was a general manager after 6 months. I made close to 6 figures, and I'm still here.
Nationally, Black women have nearly 5 times the abortion rate as white women. And Hispanic women, they have nearly double the rate of their white counterparts. But why does this racial disparity exist, and what does it mean? The answer is layered, and we should probably start by looking at the number of unintended pregnancies.
62% of pregnancies are unintended in Mississippi. It ties Washington, D.C. for the largest percentage of unintended pregnancies in the nation. Mississippi also has the highest teen pregnancy rates in the U.S., and Mississippians are less likely to use contraception. Johnson says this is the second unintended pregnancy she's had this year, despite using a combination of contraceptives.
I took birth control, used protection. Anytime we had unprotected sex, I actually took 2 Plan Bs instead of 1.
And then you're still
pregnant.
Mississippi has a single abortion care fund, which is part of a network providing financial aid to people seeking the procedure around the nation. Johnson plans to utilize it and other sources to come up with the money for her medication.
I'm actually between jobs right now, but they do have support through 3 organizations that can help me with funding, and my partner will also help with funding.
And just because a fund is based in a state, that doesn't necessarily mean you have to be a resident of that state to receive aid. For example, the New York City Council recently approved funds for low-income women who live in the city and/or travel to it to seek abortion access.
So much about abortion accessibility is based on location, location, location. If a state severely limits abortion access, the burden can be pushed to surrounding regions.
What's the farthest a patient has traveled to seek care here?
In this particular clinic, I've seen a patient that's driven from Dallas, Texas.
Texas, it doesn't border Mississippi. To the east of Mississippi is Alabama, which enacted what some are calling the country's most sweeping law. It's a near total ban. To the west is Louisiana and Arkansas, both of which have providers, but also have a mandatory counseling and waiting period. And then there's Tennessee to the north, which is pushing for a total abortion ban with the hopes that its case makes it to the Supreme Court to overturn Roe v. Wade. For some impregnated people seeking abortion care, the closest provider is out of state, in part because of stringent legal conditions. Each trip costs not only time, but also resources and dollars. Those financial tolls disproportionately affect impoverished people.
Getting to an abortion clinic is really about, you have to take time off of work, you have to find childcare, you have to find transportation if you don't have it, gas money, all of those things, and then you may be in a situation where you have to go to your abortion clinic 1, 2, or 3 times in order to get the safe care that you need.
75% of those seeking abortion care are poor or low income, and 49% of those people live below the federal poverty level.
People with lower income and people of color are more likely to seek abortion care later in their pregnancies. And a lot of that has to do with some of the systemic barriers to access.
The average cost of an abortion procedure at a healthcare center is between $350 and $950 in the first trimester. That price usually increases during the second and third trimesters. It also costs more if the procedure is done at a hospital.
For many patients, these will be out-of-pocket expenses because of the limitations of insurance coverage, assuming the patient even has it. Low-income women are less likely to have insurance and more likely to have unintended pregnancies, regardless of their race.
Johnson is one of those uninsured, low-income women. The cost of this procedure is the equivalent to about 1 month's rent.
How much is this going to cost you out of pocket?
Out of pocket, this is going to cost me $600.
What else could you be doing with that money?
Paying my rent, making sure I have groceries at home, making sure I have gas for work, making sure just basic needs.
11 states restrict insurance coverage of abortion care in private plans written in state. That includes federal plans.
For most abortions that occur in this country, they are paid for out of pocket. There are limitations in most states on Medicaid funds or Medicaid dollars being used to pay for abortions. In many states, there are actually laws on the books that say that even private or employer-based insurance policies cannot cover abortion care.
Research shows that women who seek abortion access but are denied care are much more likely to experience economic hardship and long-lasting insecurity years after they've given birth.
Go ye into the world and preach the gospel.
I wanted to talk to the anti-abortion activists picketing outside the clinic about the racial and class differences statistics show. And while some of them were very willing to discuss their religious beliefs with me off camera, none agreed to an on-camera interview about socioeconomic impact. This is an afternoon where Williams already has put in several hours at the clinic. She's still got more, and it's the work she wants to be doing.
For me, it's incredibly satisfying. You know, I think it's really important as a physician to be able to offer the services that your patient needs. Our staff is almost exclusively Black women. There is something to be said about Black women taking care of other Black women and women of color.
The demographics of the staff and patients here are very different from the racial and gender makeup of the protesters outside the clinic. During this 3-day stint, Williams will have seen nearly 50 patients before heading back home and planning a return visit. She sees this work as part of her mission as a healthcare provider.
Abortion is a normal part of healthcare. Abortion is sometimes complex. Probably every person knows someone or loves someone who's had an abortion, they just don't know about it.
Hey fam, thanks so much for watching. Don't forget to like, share, and subscribe. Please let me know what stories you want me to cover next, and I will see you next time. Bye.